Welcome to Module 5, Containment, also known as hand hugs. In this module, we will discuss how intentional touch can support your baby. Touch is one of the earliest ways parents and babies connect. In the NICU, however, babies may respond differently to touch than infants at home. Premature and medically fragile infants are still developing their ability to process sensory experiences. Because of this, some forms of touch may be more helpful than others. Containment, sometimes called a hand hug, is an intentional developmental care strategy that helps babies feel secure, organized, and supported. In this module, we will discuss what containment is, why it is beneficial, and how you can safely use containment to support your baby during caregiving and interaction. By the end of this module, you will understand how intentional, supportive touch can help your baby remain calm and organized during daily care activities. You will be able to define containment and hand hugs, describe the benefits of containment, identify situations when containment may be helpful, and demonstrate proper hand placement during containment. Now, let's discuss what containment is and how you can participate. Containment is a form of intentional touch that provides support and boundaries to your baby's body. Rather than stroking or patting, containment involves placing your hands steadily on your baby and maintaining broad, firm, but intentional pressure. This type of touch helps recreate some of the boundaries babies naturally experience before birth. Containment can help babies feel secure, supported, and organized while they experience caregiving activities or recover from stimulation. Many babies find steady touch calming because it provides clear, predictable sensory information. So, how does containment provide support? Let's talk more. Containment provides several developmental benefits. When babies feel supported, they are better able to regulate their breathing, movements, and behavioral state. Containment helps reduce stress during caregiving routines and provides comfort during transitions. It can also encourage babies to maintain flexed, organized postures and support their developing ability to self-regulate. In addition to supporting infant development, containment provides an opportunity for meaningful interaction between caregivers and their babies. Even simple moments of touch can strengthen connection and bonding. Now let's look at how to provide a hand hug. Place one hand gently over your baby's head, shoulders, or upper body. Using the pinky side of your hand to support under the tops of the shoulders can help with flexion. Place your other hand over the lower body, hips, or feet. Be mindful of joint alignment. These positions promote flexion and extremities at midline, which, as you have now learned, is a comfortable, regulating position. Your hand placement may vary based on the activity. For example, during a diaper change, one hand under the head and one hand on the arms is practical to leave the lower portion of the body available. When providing a hand hug, here are some guidelines. Use firm but intentional pressure. Avoid pressing down forcefully. The goal is to provide steady support rather than movement. Notice that the hands remain still. Containment does not involve rubbing, patting, or stroking. Instead, your hands act as supportive boundaries that help your baby feel secure. Remain in this position for several moments while observing your baby's responses. Hand placement may vary depending on your baby's size, medical equipment, and current activity. Your baby's occupational therapist can help identify touch points and positions that are most appropriate for your baby. Observing your baby's cues before, during, and after providing containment is important. As discussed in a previous module, babies communicate through their behavior. Signs that your baby may benefit from containment include finger splaying, also known as a stop sign, frantic or jerky movements, arching, changes in state, difficulty settling, facial grimacing, periods of increased stress during caregiving. Containment can also be used proactively during activities that may be stimulating, such as diaper changes, repositioning, or medical care. Always observe how your baby responds and adjust based on their cues. Understanding when to use containment is also important. Some examples include before a caregiving activity begins, during diaper changes, during position changes, during medical procedures when appropriate, following a stressful event, while your baby is settling to sleep, during skin-to-skin preparation, during periods of increased stress or disorganization. Containment is often most effective when used early, before a baby becomes highly distressed. By recognizing stress cues and responding promptly, caregivers can help support regulation and comfort. As you provide containment, you may notice changes in your baby's behavior. Many babies demonstrate signs of improved organization during containment, including relaxed facial expressions, smoother movements, hands moving toward the face, reduced stress cues, typical breathing pattern, improved ability to settle. Some babies may respond quickly, while others may need additional time. Spending time with your baby will help you learn their patterns and cues. Every infant is unique, and responses may vary depending on developmental age, medical status, and current level of stress. Remember that containment is not about forcing your baby to calm. Instead, it's about offering support and allowing your baby to respond in their own way. Observe your baby's cues throughout the interaction. If your baby appears more organized and comfortable, continue providing support. If your baby shows increasing signs of stress, try adjusting. The most important part of all developmental care is following your baby's lead. Your observations help determine what support your baby needs in each moment. Building confidence often occurs through interacting with your baby. It is common for caregivers to feel unsure on how to interact with their baby in the hospital. Containment provides a safe and meaningful way to begin building confidence. As you practice providing supportive touch, you will feel more comfortable participating in other caregiving activities and develop a deeper understanding of your baby's cues and responses. These moments of connection are valuable for both you and your baby. You have made it to the end of this module on containment hand hugs. Let's review. Containment is a simple but powerful developmental care strategy that supports comfort, regulation, and connection. By learning to use intentional, supportive touch and following your baby's cues, you can help create positive caregiving experiences throughout your NICU journey. Thank you for taking the time to learn more about containment. Your presence, participation, and partnership are valuable parts of your baby's care journey. Please speak with your baby's occupational therapist for individualized guidance and recommendations on activity participation. Remember, your healthcare team is here to guide and support you every step of the way.